As the COVID-19 pandemic continues to have its effects across the United States, the American Public Health Association is working to help address the issues around health equity and how it affects different communities. Today's episode of APHA TV will help unwrap some of the inequities and what can be done to help fight back. Welcome back to APHA TV. I'm Dina Baer, and we are beginning day 4 of this year's APHA Virtual Meeting and Expo. Today, meet exhibitors and explore new products in the virtual expo. Learn about the devastating violence and public health crisis in the Democratic Republic of Congo. Tune in to the APHA Public Health Awards ceremony and participate in the Sunset Tweet Up. Here to discuss how the COVID-19 pandemic is affecting communities of color is Harvard's Nancy Krieger. Dr. Nancy Krieger of Harvard School of Public Health is here now to talk about some important issues. Most importantly now, the impact of COVID-19 and what it's having on communities of color.
COVID-19 is having a horrible impact on communities of color and low-income communities in urban areas and in rural areas. And this is best expressed by the excess mortality that is associated. There's difficulties in getting COVID tests, for example, so it's even hard sometimes to know who's actually at what risk of being a COVID case because of inadequate access to tests. But if you look at the mortality rates, you'll see that on average, the mortality rates, particularly among Black, Latinx, and American Indian, is around 3 times higher or so. That's on average in terms of across all age groups. But when you look at working age adults, which really reflects what's going on with people who have to work at places that involve interactions with other people, they can't work at home. That's not the kinds of jobs they have. You will see mortality rates, age-specific mortality rates, upwards of 5 to 10-fold, which is enormous, a travesty, and should have been prevented.
So much of the momentum to address racism as a public health issue has been driven by police violence. How has racism operated within the COVID-19 pandemic?
So this ties into much deeper health inequities that we have in our country. And I want to add that also what the impacts on health are not only the grievous mortality and the grieving that comes from it, from COVID itself, but also the ways in which policies have been pursued around what was necessary with regard to the economic shutdowns to try to prevent a very infectious disease from hitting that could not be treated and potentially could crash hospital systems and make things very complicated for people in their communities in terms of access to healthcare, whether or not they had COVID itself. And so you can't look at what's going on with COVID outside of already existing inequities in the welfare state policies that we have in this country, the penurious approaches to poverty alleviation, the fact that how hard it is to get unemployment insurance, the fact of the lack of Medicaid expansion in so many different states. All those problems coincide. And so it's that there was a basis, who has what kinds of jobs with what kinds of protections in terms of paid sick leave. That's not a guaranteed right. If you can't have paid sick leave and you go to work and you get sick, you get exposed to somebody, do you bring it home? Is that how community spread starts in your community? What are the problems with lack of access to health insurance? What are the problems with access to lack of appropriate medical care? These all existed before COVID-19.
I know we all want to do something. What can we do to help?
So, yes, absolutely. The general public first can start with a better understanding of what the problems are. And the problems are the ways in which structural racism is shaping risk of exposure. And then if you're exposed, what that means. So a reframing that the general public needs to understand that this is not about quote unquote race, it's about racism. A second really important reframing that the general public needs to understand is that although populations of color are at greater risk, in fact, more white non-Hispanic Americans are dying from COVID because they're a larger share of the population. So this is a problem that affects everyone. And to frame it as somehow it's uniquely a problem that is affecting Black, Latinx, and American Indian populations, it's affecting them disproportionately, but to understand the toll in the United States as a whole on the failed response that requires having a full population perspective on it.
How is APHA helping disseminate the information around this issue and working to change it?
So the American Public Health Association is very much helping getting good information out on what the real risks are of COVID-19, how people and communities can prepare themselves. And during the early parts of the pandemic, particularly, they were very quick to set up webinars that were very informative for scientific professionals, health professionals, and also get that information then in a form that was accessible to the general public. They've had a very informative website. They are sending out action alerts to APHA members. I distribute them through the caucus that I chair, the Spirit of 1848 caucus. So they have been very active. It's very clear from what the legislative agendas are that they have been testifying before Congress, before different committees, advocating for a public health approach, advocating for resources, understanding that this is about protecting people overall. So that means the right economic and social policies in addition to the COVID-19 specific policies around protection, personal protective equipment, masks, and adequate access to tests and treatment.
Let's begin today's tour of organizations doing amazing work in public health.
We realized pretty early on that we needed to create a team at Ohio State to address the COVID pandemic that cross-cut many different disciplines, not just basic science, but translational and applied sciences. And this center brings together 46 different investigators from 5 schools.
I think as a center, we really want to zero in on racial inequality and racism as sort of a locus of health equity that is especially important because it's clear in the contemporary moment that that matters.
Tools and techniques like machine learning and artificial intelligence can be used to inform in near real time the work that public health is doing.
We've built very large machine learning applications to really inform a referral to a provider, whether they are behavioral health, a social worker, maybe a dietitian.
Since the start of the COVID outbreak, the Regenstrief Institute's provided information to all the counties in the state through their dashboard. They meet with us weekly to improve it.
We're looking to put the right information in the right people's hands so that we can create a healthier world.
Hicieron Compromiso was formed by leaders who came together, 5 promotoras, and what they decided was that they wanted a group to represent them. They wanted to be able to come together and to build leadership and to support each other. And that's when the network was formed, the Network of Promotoras and Community Health Workers. And our name in Spanish is La Red de Promotoras y Trabajadores Comunitarios, which is the network of promotoras and community leaders.
At the very beginning, I think the impact that we had is really bringing people to the table, really bringing people to not only come together, but to start to do work in unison. Being able to bring to the forefront what the promotor model is, why it's so effective, and centering the promotor, and as a result, centering health equity and social equity along the way.
That's it for us today, but remember, we'll be back each day of the virtual meeting with more exclusive material. And don't forget to keep up with all the latest developments and get in touch with us via the web. We'll see you tomorrow, APHA.